I deal with folks who have very sick hearts. My name is Keki Balsara, and I'm the Surgical Director of Heart Transplantation and Mechanical Circulatory Support at MedStar Health. There's an immediacy to what we do in heart surgery and with heart function, where individuals can be normal 1 minute and have had some devastating heart issue the next. We have to have the presence of mind to be able to address those problems very quickly and very effectively if we're going to end up hoping that that individual survives. So there are a variety of reasons why somebody's heart can be really sick, and in a lot of instances, medications can work, conventional surgical or medical therapies are available, but for a small subset of people, their hearts are really sick, and they wouldn't survive if they don't get a new heart. When most people think of heart transplantation, they think of the surgeon. And yes, I perform the operation, but the reality is I am but one small member of the much larger team. There are the cardiologists, the social workers, the transplant coordinators. In the operating room, it's no less than 10 or 12 individuals who are involved in taking care of the patient. And then in the ICU, we have intensivists, the nurse practitioners and physician assistants, the bedside nursing team. This is perhaps the greatest gift that any individual or any family can do. And instead of thinking about their own grief, their own suffering, their own loss, they are willing to be selfless enough to think about somebody else. In some instances, patients end up needing a permanent heart pump, something called an LVAD. MedStar Health is one of the largest LVAD implanting centers in the country. We historically have done somewhere between 70 and 90 LVADs per year, and we currently have about 250 patients on long-term durable support. In many respects, LVAD is a wonderful therapy for those patients who need it, and for patients who, for any one of a number of reasons, aren't a candidate for transplantation. Much like transplant, it does allow a patient to largely resume his or her life, and it gives many, many years of good quality of life following the surgery. I think the most important thing that I do for my patients is not what I do in the operating room. I think the most important thing is taking the time to sit down and talk to the patient. Really explain to that individual and to that individual's family what is going to happen. There's a lot of fear, there's a lot of uncertainty, and I think to take the time to sit down and explain what are reasonable expectations about outcomes, and really sit and take the time to answer questions. I think that's the most important thing.